Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Marion Nestle, it is wonderful to have you here on Public Health on Call to talk about food. How are you doing today?
Just doing fine, thanks.
You have had an unbelievable career opening Americans' eyes to what's going on with the food system and changing what a lot of them put in their mouths. And I just want to start by asking, why food? How did you get interested in food?
I just love to eat. If the truth be known, I have a degree in molecular biology. I was a bench scientist in another life. I describe myself as a lapsed molecular biologist. But on my first teaching job, I was teaching in the biology department at Brandeis. And they had a rule that you could only teach the same course 3 times, and then you had to do something new, and you had to do whatever the department needed, whether you knew anything about it or not. It was an interesting philosophy. And I had been teaching cell and molecular biology, which is very abstract and not easy to teach. And my 3 semesters were up, and they gave me a choice of human physiology or human nutrition. The students were asking for human biology classes in that department. And I picked nutrition because this was back in the mid-70s. And it was a time when Linus Pauling had published Vitamin C in the Common Cold, and Francis Moore Lappé had published Diet for a Small Planet. And the Center for Science and the Public Interest had just been founded, and one of the first thing they did was to publish a book called Food for People, Not for Profit. And I used all of those as texts in my first class, taking a very scientific approach to looking at those. What's the science that backs up the hypotheses and the contentions in these publications? And also there was a historian at Brandeis at the time, Jeffrey Baraclou, a very distinguished historian who had just written a couple of lengthy articles in the New York Review of Books on food and oil and the politics of that. I used that as a text as well. And so I was into food, nutrition, and politics right from the beginning. I mean, just right off the bat. I only taught at Brandeis for a year. I taught that class twice, and then moved with my husband of the time to the University of California, San Francisco School of Medicine to teach nutrition to medical students, and then went on from there.
Well, that is an incredible story. There are people walking around who took your very first nutrition course at Brandeis. And so you have gone on to write some very influential books and advance some pretty important ideas about the food system. Can you share some of those?
Yeah, I mean, after I left UCSF, where I learned a lot about clinical nutrition, I then had a job in Washington in the Office of Disease Prevention and Health Promotion, editing the Surgeon General's report on nutrition and health, and then went from that to New York University, where I've been ever since. It took me a long time to sort of focus in on what I was going to be doing. I have this story about this turning point. I went to a National Cancer Institute meeting in Washington in the early 90s that was on smoking and health and diet and health, smoking and cancer and diet and cancer. And I knew that cigarette smoking caused cancer. I really did. But I had never seen anybody present lectures about how cigarette companies marketed to children. I mean, I knew that cigarette companies marketed to children. It was the era of Joe Camel, but I never paid any attention to it. And the people who spoke at that meeting showed slide after slide after slide of marketing cigarettes to kids. And I walked out of there saying, we should be doing the same thing for Coca-Cola. I mean, it was the first time I had ever realized the ubiquity of that kind of marketing. It wasn't that I didn't know it existed, it's just that I'd never paid any attention before. I started paying attention.
And so when your eyes were open to this, what did you see?
Well, I just saw it everywhere. Once you start looking for it, it's everywhere, and you don't notice it. You're not supposed to notice it. As an advertising executive once explained to me, if it's done well, it slips below the radar of critical thinking. So it's there, and it's embedded in your subconscious in a way that you're not even aware of. So I started writing articles about that and eventually collected those articles into the book that became Food Politics. And that came out in 2002. There have been a couple of subsequent editions. But when the book came out, the first question that everybody asked me, what does food have to do with politics? I don't get asked that quite so much anymore now that RFK Jr. is a candidate for the head of Health and Human Services. It's pretty obvious what food has to do with politics.
We'll come back to him, but I want to ask this question. You're taking on the food industry, and you're basically saying that the food industry is warping Americans' diets. From a nutritional perspective, what are you concerned about there?
Well, first of all, the taking on of the food industry. In writing Food Politics, which has a subtitle, How the Food Industry Influences Nutrition and Health, I thought I was describing the obvious. I mean, I really thought all I was doing was giving example after example after example of food industry manipulation of whatever the situation was in order to protect the sales of whatever the companies were selling. And it was obvious to me that if you're a publicly traded company, your stockholders want you to make money. And that becomes the single greatest priority. And, with the advent of the shareholder value movement in the early 1980s, that's all that Wall Street cares about. And so it was a very simple kind of thing that it's not that food company executives were sitting around a table saying, we're trying to make everybody sick and fat. They were sitting around a table saying, how are we going to sell our product and make money in a food environment in which there's twice as much food available in the American food supply as anybody needs? And that, to me, was what this was about. And so all I did was describe the way that food companies were lobbying, the way they were focusing on personal responsibility, and those kinds of things.
Let me break it down to kind of the diet level. Let's say we had two people, one of whom was completely and utterly protected from food industry marketing, and the other one is living in reality, in the world we live in. What would be different about their diets, and why does that concern you? In other words, what is the food industry driving through that marketing? How does that translate to an individual's diet?
There are actually studies that examine this question, and those studies show very clearly that people eat more healthfully if they're not subjected to food industry marketing. And remember, the marketing isn't just advertising. It's much more complicated and subtle than that in a lot of ways. It's sponsorship of events. It's sponsorship of research. It's lobbying behind the scenes.
And what worries you most? Is it the sodium? Is it the fat content? Is it the caloric density? What are the things?
Oh, I'm a calorie person. I'm a calorie person. 75% of American adults are overweight or obese. That's calories. And it really doesn't matter where the calories come from. It's calories. And the food industry's job is to sell more food, not less. Eating less is really, really bad for business. So what the food industry has done is to create a food environment in which food is ubiquitous. It's sold absolutely everywhere. And you can actually diagram when all that's happened. Food is sold in libraries. It's sold in bookstores. That never used to be that way, and it's pretty easy to track when that happened. And it happened exactly in parallel with people eating more. People eat food that's in front of them. If the portions are larger, they eat more calories. If I had one nutritional concept to get across to the American public, it's that larger portions have more calories. I can't even say it with a straight face, but it's not intuitively obvious.
Well, let's talk about some of the interesting developments these days and what you think they mean. So, one of them is the invention of medications that really do appear to curb appetite. And so, that we've heard is cause a shock for food companies. How do you view these medicines and what do you think the future holds?
Well, I think the jury is still out on what the effect of these medicines is going to be, but I'm just fascinated by what people are saying about them. I talk to everybody I can about who's taking them, about what their experience is, and what they're telling me is that the medicine shut off the food noise. Food noise was a concept I had never heard of before GLP-1 drugs, but I sure get it. And I love the concept. What they're talking about is the idea if they've got food in front of them or food in the house, they just have to eat it. They can't resist it. And the drugs shut that off. And not only does it shut it off, but it shuts off their desire for junk foods, for what we're now calling ultra-processed foods that are high in salt, sugars, saturated fat, additives, and that we now know from some really excellent research induce people to eat more calories than they otherwise would. That's really interesting. And food companies and retailers are reporting that people who are on these drugs have reduced their food purchases by 5 to 10%, depending on what study you read. And remember that in the way the United States investment system works, you're not allowed to lose sales. You are expected to grow your profits every quarter. Every 90 days, you report growth to Wall Street. So the idea that these companies are losing sales is very alarming to them.
I kind of picture you watching this battle with some popcorn, not too much and not overly buttered, but maybe watching with a lot of interest. Is that fair?
Everything in moderation.
Let me ask you about RFK Jr. Suddenly you have a major nominee for a big job who's talking about the food system. That hasn't happened in quite a while. What do you make of this?
Well, first of all, I'm really excited about his talking about the food system. The idea that the food system is being discussed at that level, I just don't ever remember anything like this, except for Michelle Obama. I mean, it's so ironic that, she was practically shut down by the Republicans. And here's RFK Jr., who is picked up from where she left off and taking it even further. And I love it that he's talking about getting chemicals out of the food supply. I love it that he's talking about getting mercury out of fish. I love a lot of what he's talking about. Getting ultra-processed foods out of schools, I'm all for that. And it's thrilling to hear somebody at that level talk about these things and bring them to public attention because nobody else has done that. If you want people to eat less of the wrong kinds of foods, you're taking on the food industry. He's taking on the food industry. Not only that, but he's taking on the coal-burning power industry because that's where the mercury that gets into the fish comes from. It'll be interesting to see how well he does with that.
Well, you wrote the book Food Politics. What do you think the chances of a movement like this are these days? We don't know as we're talking whether or not he will actually be confirmed, but
well, that's the first step. The second step is what is he actually going to do? It's very hard to know how campaign promises will get translated, if they get translated at all.
Right. And he's not at the Department of Agriculture, for example.
Well, he's being considered as Department of Health and Human Services. That's the FDA. A lot of what he's talking about is under the purview of the Department of Agriculture. And so it's unclear how all of that is going to work out. I'm watching it with enormous interest.
Last question for you. You've been really generous with your time. It's been wonderful to talk with you. I'm curious what you have in your refrigerator these days. What did you have for breakfast and lunch? Like, what does Marion Nestle eat?
Well, I go into the category of the late elderly. And one of the really dirty tricks about getting old is you can't eat as much as you used to. So I feel like somebody on a GLP-1 drug, even though I'm not. So I tend to eat quite healthfully. I would never suggest that people eat in any way that I don't do. And I think it's very easy to describe healthy diets. The journalist Michael Pollan can do it in 7 words. Eat food, not too much, mostly plants. That's how I eat.
Great. Any favorite foods you want to share with our listener?
Oh, my favorite food is ginger ice cream.
Okay, there you go. Marion Nestle, thank you so much for joining me on Public Health on Call.
My pleasure.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.